November is Diabetes Awareness Month. Joining us in the studio, we have Christy and Sarah, both nurses with UPHS Marquette on the diabetes and nutrition team, correct?
Correct.
Excellent. How are you two doing this morning?
Good. Good. How are you?
I'm doing great. Thank you for being here. So today we're talking about diabetes. First question, why is it important for our community to recognize this, and what are some of the biggest misconceptions about diabetes?
Yeah, I think it's so important for our community to recognize how important it is, because diabetes it's really becoming an epidemic. It's so prevalent, and especially in our community, because we're a rural community, this disease can be so hidden, and our resources to most of our patients can be so limited because of their locations. You know, I think that a lot of the misconceptions too can be that diabetes is from people who are fat, or people who just eat sugar, or people who are just overall generally unhealthy. But there are so many more factors to it. There's genetics, there's just other risk factors, other disease factors that can contribute to so many things that can contribute to diabetes.
Okay, yeah, and so what are some signs and risk factors that could indicate somebody is either pre-diabetic or has diabetes?
And that's kind of building off of what Sarah said. Diabetes is often hidden for a long time because a lot of the time there are no symptoms and it's a silent disease. So a lot of the time what happens is people don't have any symptoms. So a lot of time people are feeling well until all of a sudden they're not feeling well. So one of the biggest measures of monitoring or diagnosing diabetes is hemoglobin A1C. So sometimes people aren't going to the doctor for a lot of different reasons, but they aren't going to the doctor until they're not feeling well. So they might not, they're feeling unwell finally because they might be excessive thirst, excessive urination, excess hunger, and weight loss. So that might bring them finally to a doctor or even the emergency department, and all of a sudden they have developed diabetes that has been undetected for maybe even years.
Wow, yeah.
Absolutely.
Yeah, and prediabetes can be a very long period of time, and then all of a sudden, bam, just like Christy said.
Mm-hmm. Wow, yes. And so how can individuals and families in our community take practical steps to prevent or manage diabetes through nutrition, exercise, and healthy habits?
Well, I do think one of the main things we can do is make sure that we do have a primary care doctor, because there are, like I mentioned earlier, A1C, fasting glucose, different things that can be done to make sure that if you have prediabetes that we are catching it early on. And if you are having these symptoms that I had mentioned, so excess thirst, excess urination, excess hunger, weight loss, that we are catching that as well. But on the lifestyle front, we are doing things like getting proper exercise, eating a lot of protein, fiber, and just making sure that we're having a balanced diet. That's very important in managing both prediabetes, diabetes, and even staving off these conditions before they occur.
I think also people don't realize that carbohydrates also come in liquid form, and that is really prevalent in, I think, a huge contribution to diabetes as well.
Yeah, makes sense. Yeah, people probably don't think of that. And so for people who are already living with diabetes, what resources or support does UPHS offer to help them stay healthy year-round?
Well, I mean, UPHS has a wonderful family practice, and they have locations all over the UP. But also in our team, we have our nutrition, wellness, and diabetes department at the hospital, and we offer inpatient and outpatient services. So most likely, if you do have diabetes, a lot of times you will see Christy or I in the inpatient side, and then on the outpatient side, if you have a new diagnosis, you can come and see us, or we can get referrals from your primary care provider. And you know, we just get a bigger opportunity to sit down and talk about the disease with our patients. I always tell patients, you know, when you see your family doctor, they gotta talk to you and treat you from head to toe. And Christy and I, we just we just do diabetes. So we really get to go in depth, and we establish a really good relationship with our patients.
And whether your interest is managing with lifestyle changes, medication management, technologies, so insulin pumps, continuous glucose monitors, or often a combination of all of that, we have that knowledge to be able to help you.
Okay, yeah, and so as we head into the holiday season, it can be harder, to stay on track with those healthy habits. So what are some realistic tips so people can enjoy the season, but while keeping their blood sugar in check?
The biggest thing that I always like to tell people is go in with a plan. The holidays are meant to be enjoyed. You're there with your family, so you don't want to deprive yourself. The holidays come around once a year. We have Christmas, we have Thanksgiving, and we have all of our favorite foods. So we don't ever want to make people deprive themselves. So going in with a plan, and that starts off with, if your holiday meal is at lunchtime or dinner time, we want to make sure that you are still eating something before that, because I can't tell you how many times I've had people say, I'm just skipping the meal before because I want to save everything for later on. But what happens with that is then we are going to overeat later on. So try to make sure you're eating something beforehand, and then go into that meal with a plan. And it might not be, if you have diabetes or prediabetes, maybe you're not eating the portion that you did before, but you should still feel comfortable eating the foods that you normally would eat. And maybe you're eating more vegetables than you did before, but you're planning on eating the foods that you normally do, just maybe a smaller portion. Trying to get some exercise during the holidays too is important. And I always remind people too, if it doesn't go the way that you planned, it's just 1 day or 2 days, and just move on from it if it doesn't go according to plan.
Yep, I would agree. For sure. And that exercise, I feel like for people who have diabetes, it's like, it doesn't have to be a full-on crazy workout. So maybe, you get your family members together and you go take a walk around the block after dinner. And then I always tell people, don't wait till the end of the night to eat your dessert. Try to eat it as close to dinner time as possible. And then, yeah, I think that everyone should be able to enjoy themselves, and quality of life is just as important as our diseases.
For sure, yes, yeah, very helpful tips. We appreciate it a lot. Is there anything you'd like to add this morning?
Yes, the other thing is hydration is important during the holidays too. So staying well hydrated, especially if you're going to have those holiday cocktails. So making sure you're drinking plenty of water is also important.
Yes, have that water bottle nearby.
The last thing I would like just to say is that nobody should be ashamed to reach out for diabetes help. It is so much more prevalent than any individual actually really knows, and I feel like that's why Christy and I really do love our jobs, is because just being there to help patients and help people with diabetes is truly a passion of ours. And we see more often than not than people coming in and thinking that seeing one of our faces maybe might be a failure, that you're seeing a diabetes educator, but really no, you should take advantage of every support that you can have.
Yeah, a lot of our patients will leave and say, that wasn't as bad as I thought it was going to be. So.
And like I said, we establish such good relationships with our patients, and we see them for years. So.
Yeah, excellent. Yeah, we'll have all that information on resources too on our website, myupnow.com. Christy, Sarah, thank you so much for joining us this morning.
Thanks for having us.
Yes, and stay with us. We'll be right back with more My UP Mornings after the break.